Hello, I'm Lowell Martin, and this is MCC Today. We try our best. On today's show, we have Dr. Laura Lewis, Mallory Hardy, Kristy Ethridge, and Kim Rush. We've got a lot of really good information for you, so stay tuned.
Thank you to the teachers for encouraging me when I wasn't sure where to start, for seeing my potential even when I didn't, for inspiring me to reach farther and try harder.
Thank you, MCC. You helped me change my future.
Find your wings at MCC.
And we are here with the wonderful Dr. Laura Lewis and Mallory Hardy. How are you doing?
Good.
Everything going well today?
Yes.
Now, you are an instructor here at Meridian Community College and have been for a very short period of time, because I've known you forever.
I think around 15 years.
Around 15 years, yes. And you started out
Well, I started out recruiting.
in recruiting, and I think I've been with you throughout your entire doctoral process.
Yep, went through that.
So, and now you're you have your doctorate and you are teaching for us. And what classes do you teach?
So I teach health and wellness courses. Really pretty much anything in the HPR department that, allows me to teach what I love, fitness and wellness and health.
Community health.
Personal community health concepts. I've taught weight training and spinning, first aid and CPR, recreational leadership. So there's a lot of different things that they let me teach.
And Miss Mallory Hardy, you are the workforce manager?
Project manager.
Project manager,
yes.
Which means what is that?
So I actually manage the medical side of things. So
Okay.
I do phlebotomy, pharmacy tech, CNA for non-credit. So we're non-credit,
Okay.
short-term classes, but I also teach CPR, dental rad, a lot of different stuff. So
Okay, and how long have you been doing that?
2 years this month.
Oh my.
Yeah.
How's MCC been
I love
treating
MCC.
you? Good.
It feels like family.
We say that, and we talk about the MCC family a lot, but it really is
It
true.
is. It is.
It is, and I'm just going to say, I'm just going to throw this out there, because Laura Lewis annoys the you-know-what out of me sometimes, because she is so dang fit.
I know.
And she is so good with her diet, and anytime we go and we're eating or something, she has like her 3
That
beans.
is not true. Now don't
And
lie
her
to
4
people.
grains of rice, and then she'll like, oh, I'm so full. You just want to,
I eat a lot, actually.
So she says.
I eat
I'm
about
just saying,
1,200.
your a lot and my a lot
Yeah, well.
would be, because I'm going to eat until the cook comes out with a white flag. Just like,
Well, I eat a good many calories a day, because I lift weights, so I have to.
I know. I am jealous. I'm extraordinarily jealous, because you have
We used to work out
amazing
together, too.
self-control, and that is just amazing.
It's hard to do. I'll be 40 this year, Lowell. I'm not too far behind you.
Don't even. That was very sweet.
Well, hey,
I had just said before the camera that I'm turning 60 soon, and 40 is just behind 60. Just
I was
a
trying to pay
tad.
you a compliment,
And,
right?
And I appreciate it. I appreciate the effort. And I bet you hadn't even turned 30 yet, have you?
No, I'll be 35 in
Oh,
February.
wow. I did not know that, Mallory.
You look so much younger. I'm not saying, I don't mean that in a bad, but
Yeah.
like, wow, okay, so 30, but still, I got both of you beat. All right, the whole purpose of you being here is to talk about wellness on campus, which we are, I know the administration is very committed to wellness, because, keeping your employees happy and healthy is very important.
Oh, yes.
Absolutely.
Okay, so what is our wellness program here? What does it entail?
So I'll let Mallory take point on
Oh,
that.
okay.
Well,
I'll
we
let Mallory do that. You noticed she did. You know how she did
I
that.
told her I was going to do that.
So Laura has been doing a phenomenal job with this, and I
Yes.
found out about this working in a field before this, and I was so jealous and just intrigued by what y'all offer, so I'm so glad that I'm able to be a part of it now. So I worked at a fitness center and we didn't have the kind of perks that you all had, so it's really awesome. But we have a canvas shell that has our wellness information. So we provide all kind of information out there. There's monthly webinars, we have recipes, fitness tips and tricks.
The cool thing about our wellness program is that one of our policies states that we as employees, full-time employees, are able to take 3 hours per week of wellness, per week.
Per week.
Per week of wellness. And so what that does is it allows folks to come to our fitness center, walk around campus, or take a class. And we also have an online component, as Mallory mentioned. If people don't have time to do these other types of things, they can stay in their office and do things like active health webinars and just other things that we have created for those folks who cannot get away from their office. And another thing that we have is our online classes for employees who would like to leave campus and actually do activities off campus. Like if they have their own personal fitness center they like to go to, they have to sign up for the class first, and then they can go off campus and they have to report weekly logs to us, and that helps keep them accountable for what they're doing.
And I think that's very important, and we've been doing this for a number of years.
Oh,
is
yeah.
that say you have a 40-hour week, you're able to take 3 of those hours, I mean literally 3 of the hours that you're supposed to be at work, and exercise.
That's right.
And that is, that shows the commitment of administration to this. But it's also, and I think, holding us accountable, because I would be the one that says, wink, wink, I get 3 hours. I'm out of here.
Yeah.
No, I wouldn't really, well, sometimes. But
well, we have pretty strict
But you
regimen,
are
pretty
very
strict routine with
strict
it, and we're pretty good at making sure that if they're not doing what they're supposed to be doing, guess who gets to get in trouble? They get in trouble if they don't do what they're supposed to be doing. And of course, some people will submit Garmin, tracking pictures and logs and things like that. But it's really interesting because I can kind of see what people are doing and kind of give them some pointers, hey, you might want to do this. Hey, in some of these classes, like for instance, our online platform is 16 weeks. So there might be a time where I say you need to take a recovery day or a recovery week, something like that. So we're really good.
Decade.
How did I know you were going to say something like that? No, but we do work with our employees. Some weeks you just cannot do what you want to do physically, even sometimes emotionally. But it really is good for us to know that we have that ability to do these things. Because I'm going to tell you, we are way ahead of the game, especially in the state of Mississippi, with our wellness program that we have here. Not a lot of places offer that.
Well, one of the things, and I think we're just waking up to this, and this is something that I think people who are very committed to exercise know, is how much that this helps your mental health as well as your physical. Because I will go walking, and I know that is very important to me. It's good for my heart, but it also, I need that time to mentally.
Yeah.
And I think we're waking up to that as well, and I think it benefits all of us.
Right. So if anybody wants to join the wellness program, just joining, just actually taking those hours off your door schedule, is all you have to do is ask your supervisor, hey, can I do wellness, 3 hours a week? And
they actively encourage it.
They do.
I don't know of anyone that would say no.
Right, and they try to work it out with all the people in that particular area. For instance, admissions, financial aid, they have certain work schedules they have to work around. But and if they want to join a class, they can do that. Or if they want to do an online class, they can do that. Or they can do the Canvas portion. We work a lot with Blue Cross Blue Shield.
Good.
And with their wellness champions too. And they do a lot of stuff online as far as phone calls and things like that.
Well, listen, I want to thank both of y'all for being here, and I really appreciate it. I'd love to have you on again, and let's talk further and joke further, because it's been loads of fun.
Yeah, definitely.
Thank you.
We'll be right back.
Since 1996, the MCC Foundation Tuition Guarantee Program has provided students an opportunity to find their potential. Thousands of students have benefited from the program. Over $6 million have been invested in the students who learn and live right here in our community. This program is funded by individuals and businesses who believe in our students, our families, and the economic impact of an education at Meridian Community College. Now is your chance to offer support. Give today at meridiancc.edu/give.
And we are here with the wonderful Miss Kristy Ethridge. How are you doing?
I'm good.
Now, you are the program coordinator for the CNA program, also called the HCA program.
That's right.
But as we said, more people would know the CNA
They
program.
know CNA other than, healthcare assistant.
Okay, and we've been doing this for how long? How long have you been doing
20 years.
Oh my
20
gosh,
years.
20
Yeah.
years. And it's a one semester program, 1 year.
It's one semester, so I've had 40 semesters.
Oh my gosh, okay.
Yeah.
And and this is something that is necessary and needed because we need good CNAs, quality CNAs out there. What kind of prerequisites does a student have to get into your program?
They don't have to have any prerequisites at all. They have to have a 15 on the ACT, or
Okay.
they can take the AccuPlacer
Okay.
and make a 210 in math and reading.
So they will have had to have graduated from
Have to have a
high school
diploma or a GED.
Okay.
And we have there's some grants that if they get their GED, then they can simultaneously be taking my class, and they'll pay for that. So.
Okay, so while they're working on their GED, they can also take your class, and at the end of that semester, are there good job opportunities out there waiting?
I tell my students if they want a job, they can go anywhere they want.
Okay.
Any nursing home, they're all very short of CNAs. They all need CNAs. Hospitals hire CNAs, clinics hire CNAs. I mean, they're just, and private sitters.
Okay.
That's needed also.
Now let me ask you the $4,800 question is money. Are they making decent money? Is it?
They're really starting to come up with that.
Okay.
One place I know of now, they're $13.50 to $14 an hour.
Okay.
So that's come up a
That's
lot
one
over the
semester
years.
of study,
One
and then that's
semester.
what you can get.
That's
That's
right.
what you start out with, hopefully.
And I tell my students, you can go anywhere you want to. Work where it makes you happy. If you're, hospital, and now they hire CNAs in all the units like ICU and CCU and labor and delivery. They used to not. Now they hire them everywhere. So
Okay.
they can get a job just about anywhere they want.
Now, is there any kind of exam or anything at the end of the program where, like I know in certain other medical programs, they have to take not boards, but they have to take something to be able to go elsewhere.
They do.
Do we do that with CNA
And that's why
program?
we're called the healthcare assistant class, because they're healthcare assistants. And when they graduate, they take the CNA, the certification test. And we do that here too. That's another advantage. You have to take it somewhere in Mississippi, and there's about 5 testing sites, and we're one of them.
Okay.
So they're used to our building, the site and everything, and where all the supplies are and stuff. And so that's kind of an advantage.
Okay.
But yeah, then they become certified.
And then once they're certified, they can pretty much go anywhere.
They can. By law, they have to be certified in a nursing home.
Okay.
Hospitals, and clinics, you don't have to be, but now they're starting to get to where they like them all to be certified.
Okay.
So.
How many new students do you take each semester? Or how many students? I know you take a new class every semester. That was a stupid question. I had to think about it for a minute.
Every semester.
But every semester. But how many students do you accept into the program every semester?
Right now, 15.
Okay.
Now, it used to be, enrollment's down everywhere. It used to be that we could accept 30 because we
Right.
had 2 instructors, but
Right.
since it's been down, we've had to move 1, and so 15. But if
Okay.
that starts to build up again, we could do 30.
Okay. So if someone is sitting at their home and they're like, I don't know, what am I going to do with my life? How can you
CNA.
promote your program? What type of individual are you looking for who could do well in your program?
And this, high school students, straight out of high school, you don't know what you want to do. If you think about health care, try CNA, because it's you can start right away, 1 semester, and then you're employable. You can go get a job. You can work part-time. They'll work around your schedule, most if you're going back to school. And if you don't know, really, if you think about nursing, you don't really know, that'll let you know if you want to be a nurse or not.
Sure.
And then it helps you be more competitive to get into the other programs, because
Right.
they admit by the point system. So you
Okay.
get an extra point to get into the LPN or RN. So, and that first semester, just that experience and that going into the clinical site, you know, you've already kind of done that. So that kind of helps you in that first semester of that other one.
Okay,
you
so
know,
if you're
and-
just kind of flailing around and you don't know what to do, why not try it? And you
Yeah.
think, well, hey, I want to go into healthcare. Okay, well, let's start here. Do you have many students that progress
I do.
from CNA up
always,
to nursing?
Always have some. Some of them will go straight from my program to LPN.
Okay.
And then, you know, there's
So they could work and pay their way.
right, and
or
there's
work,
quite a bit of prerequisites to get in the ADN program.
Right.
But you know, it helps them in knowing what they want to do, because I've heard of students going through their 2 years of prerequisites, getting in the ADN, then they say, hey, nursing's not what I like. So that kind of really helps them say whether they like it or not.
Now, y'all do a lot of hands-on in the program as
We
well.
do a lot of lab, because there are
Right.
certain skills they have to know, because they're tested on skills.
Okay.
And we go to the nursing home and do clinical.
Okay.
And we do a lot of clinical.
Do you do
So-
all the clinical in one place, or do you have different locations?
Right now
that
we
you
do. We go to one nursing home.
Okay. Okay.
Yeah.
And because I know in other, you know, they will go to different clinical
If
areas.
we had
but-
the other instructor, if we
You could
build
do-
back in our, you know, we do two then, so
Okay.
they get to kind of see different
That's-
areas.
That's the one thing about our medical programs, is that there is such an emphasis, which is wonderful, on the hands-on stuff. And
Right.
you know, because there are only certain things that you can learn in book.
That's right. It's different in
You
the
know?
everything's. I don't care what you take. It's different in the real world.
I mean, you know, I can read and read and read about giving a shot, but until you actually start,
Until you-
it's like,
Yeah, that's right.
And no matter, I don't think I'd be good at it. Now, what made you go into this field, if you don't mind me asking?
Teaching.
Teaching, and did you start out as a?
Well, yeah, I'm an RN.
Okay.
So you know, I went from delivering babies to geriatrics.
Okay.
And you know, I just got the opportunity to come here and teach CNAs, and I worked with them, and I loved them. So you know, I love teaching them. I do.
Because a lot of times, you know, sometimes the people behind the scenes are so important.
Oh, they're the backbone of the facility. I mean, they really are, because they know the residents will talk to them before they'll talk to an RN. You know, because they're with them every day. They're kind of like their family sometimes.
So if someone is watching and they're interested in the program, how could they get more information about it?
Going on to our website, for one
Okay,
thing.
okay.
They could always, you know, my number's on there, my email's on there. Email me, call me. I'll help them send them in the right direction.
Okay.
You know,
They
help
can also
'em-
go in and talk to an advisor.
They can talk to the advisor, yeah.
And so there are
Laquita
many number of
Chambers
ways
is
if you're interested. And this is something you take for one semester, you get certified.
one
and
semester, certified, get a job,
listen-
or move on.
Or move on.
That's right.
Thank you so much for being here today.
Thank
I really
you
appreciate
very
it.
much.
We'll be right back.
Not essential. Never let anyone tell you that again. Never doubt your abilities to make a difference. How do I know this about you? Because I'm a teacher. I am the one who will push you harder and farther than you could have ever imagined. Teach you things that you never thought possible. And if you will give me 100%, then I will stand shoulder to shoulder with you, and together we will change your future. MCC, find your wings.
And we are here with the wonderful Miss Kim Rush.
Hello!
How are you doing?
I'm doing great. How are you?
I'm doing well. We were just talking about how I never see you.
Yes.
We're in meetings
All the
together all the
time.
time.
Yes, but it's good stuff.
It is really good stuff,
Yes.
and very good stuff. Now, you are officially, your title is Dean.
Long.
Yeah, what is it?
Associate Dean of Advising, Retention, and Student Success.
Congratulations on
Yes,
that.
thank you.
Are you paid by the syllable?
I don't want to talk about that. I wish.
But we've got some exciting things coming up.
Yes, we do. So right now, currently as we speak, we are in the midst of spring registration.
Yay.
Woo! So yes, we are very, very pumped about it. We have been seeing students come, get registered for classes, talking to their advisor about how things are going for the fall semester, making plans for the spring semester, and then we start our new students who are not currently at MCC, We would start registering them on November the 15th.
Okay.
Yes.
Now, currently, the students who are already here
Yes.
can go to their advisors, can
Yes.
register. That is their privilege
Yes.
because they're already students here.
Correct. Go, go, go.
Go get all your stuff done.
Yes, and the goal is we really want students to get registered either before Thanksgiving break, but definitely before Christmas break. Because you know Christmas break is a little bit long.
Oh, yes. Thank goodness.
Whoop.
Thank
Yes,
goodness.
yes,
Thank
yes,
goodness.
yes. And you know what's so funny about that? Students don't know that they don't return until January 17th after MLK.
I know.
Hallelujah.
The Tuesday after MLK is when we
Hallelujah.
start. I'm just saying.
Yes. But it's a good break.
Yes, it is a
Yes.
good break.
Yes.
It is a good long break. And now, but spring semester, you know, we have a class that actually, our classes that actually happen
Yes.
before spring.
Yes, yes.
They're counted as spring.
Correct.
But they happen before spring.
Yes.
Okay.
And those classes, we call them our holiday term classes. And normally those holiday classes are 3 weeks.
Right.
Well, with our longer break for Christmas, they're 5 weeks.
Okay.
So students always say 3 weeks is kind of close, very, very short, and I get it, it definitely is. And so our wonderful VPs with instruction have decided to lengthen our holiday term to 5 weeks.
So we're going December 12th
Yes.
through January 13th,
Yes.
I believe, right?
Yes, and I'll tell you the benefit of that as well is that the first week we are still on campus, even though students are gone.
Right.
Advisors will be still on campus, and when they before the class ends, we'll be back on campus.
And sometimes, because I teach a holiday class, and sometimes, you know, there are questions that you have to ask someone on campus.
Correct.
You know, we don't have many of those, but it's nice to know
Yes.
that when you do, somebody's going to be there.
Correct. So if they have an issue with like Canvas, login, all that, we can help take care of them while we're still on campus.
Now, what kind of classes are we offering during the holiday?
Well, guess what I have?
I
Handy
saw
dandy
the sheet.
list.
Okay.
So we have AMP1, AMP2, and this is again both lecture and lab. We have chemistry survey, human growth and development. We have Comp 1, Comp 2. We do have college study skills. Woo! We have college algebra, intermediate algebra, trig, stats, music appreciation, journal psychology, and lots of HPR classes as well.
Now, let me say this, and and I want to stress this too, is when you take a class like this, you are still doing all of the work
Correct.
that you would be doing
Yes.
in a normal semester, a normal,
Yes.
you know, like with your English Comp 1 issue. So be prepared
Yes.
to do the work.
Correct.
Okay?
And so, as I tell students all the time, it is 15 weeks. It's 15 weeks condensed into 5. It is not less work, it is less time. And
Right.
that is very important to know.
And the classes that you take during the holiday term count toward the
Correct.
spring semester.
Correct. And we have a lot of students, say for example, they'll get caught up, or they'll take a class in the holiday term so they don't have as much of a load
Right.
in the spring term.
I tell a lot of our student athletes, you know, especially if they're going to be very busy in the spring,
Yes.
that you might want to take a class
Correct.
or two over the holidays, but give yourself plenty of time
Correct.
to do the work.
Definitely so.
Okay.
You will have assignments due over Christmas.
Now, we will continue registration
Yes.
through
Up until, spring registration.
2297.
Yes, correct. So spring registration, it doesn't end until the first full week of classes on campus, and that'll be in January, or after the week after online classes. And those, of course, for full term classes. Now, the deadline to register for the holiday term classes is after the first full week as well.
Okay. And the thing is, and I tell students this all the time, don't wait until you come back from the
Correct,
holidays
correct.
to register. Go ahead and get it done, because if you have times that you want to take a class in, if you have certain teachers that you want or whatever, you better lock those in.
Definitely so.
Because if you do not, there is no guarantee
Correct.
that they will be available later on.
And that's why we ask students to go ahead, especially our students who are current MCC students, to go ahead and register now, because you don't want to wait until after Thanksgiving or even after Christmas, and then the classes are filled up and you have to take other classes.
Yes.
Definitely.
Will the financial aid pay for holiday classes?
Yes.
Okay.
It's considered the spring term. So as long as you had a financial aid package for the fall and you did well in the fall semester, financial aid
There's
definitely will
that.
pay. Yes, there is that part. Do well, and it will continue on, definitely.
I'm having now, and this is a little bit of an aside, but in the Success Center, when people will come in, they haven't been in the Success Center all semester, and suddenly they come in and say, I need help on this paper, I failed 3 other papers, what am I supposed to do? And I'm like, I don't know.
Yes. Hope.
I mean, yeah, hope,
Yes.
pray.
Yes, definitely so.
Because, and I tell students this all the time, and I know you do too. She's technically my boss. And a great boss. But
Sidebar.
don't wait till the last minute
Yes.
to get help.
Yes.
Because past a point, numerically,
Yes.
there's nothing that can
It's
be
very,
done to
very,
salvage
very
your grade.
difficult. So we
Yes.
tell students when you start struggling, in August, September, then seek out support because
Yes.
again,
The
the farther
first
you get
paper.
in the semester, the harder it is to remediate that grade.
Yes, and hopefully and a lot of people did take advantage of it, but now, we have those people who are like praying for, they're like,
Yes.
please,
Yes.
please just let me do this, just let
Yes.
me this. And I'm like, well, maybe.
Yeah, it's just very difficult at that point,
Yes.
And when your student could have made a B or a C and now they're hoping for a D, when in reality, if they'd have put the time in early on, they could have gotten a B or a C.
And sometimes it is reality too, because I've had students that will come to me and say, what can I do to make an A? And you're like, take the class again?
Yes, yes, a retake.
I mean, and I'm not, I'm not a mean teacher. I'm not a hard teacher, but by golly, do your work.
Correct.
And it's the same with anything you sign up for. Realize that, with this English, you're still going to have a number of essays that you're
Correct.
going to have to turn in.
Correct.
With that A and P, you said A and P?
Correct.
Okay, 1 and 2 with
Yes.
lab. Oh my goodness.
Yes.
Be prepared.
Correct.
Because.
Again, it's 15 weeks condensed into 5. It's not less work, it's less time.
Okay. Listen, as always, I want to thank you for being here.
Thank you.
And I'm sure I'll see you again in a meeting
Yes,
probably this
tomorrow,
afternoon
yes.
or tomorrow.
Definitely.
But I really appreciate it.
Thank you so much.
We'll be right back.
Meridian Community College. For more than 75 years, we've helped students soar. Establishing the first tuition guarantee program in Mississippi, we put our students first while creating pathways into the workforce and offering a seamless transition to a 4-year degree. Now is the time to find your purpose and register today, because those who move forward never get left behind. MCC, find your wings.
On behalf of executive producers Matt Milner and Tanisha Clark, media specialist Josh Taylor, and student producer Tayshawn Gilbert, thank you so much for watching. Hope you learned something. See you next week.